Okay, intramuscular injection demonstration. So I'm going to start by verifying the accuracy of the order. So I have my order here. I have an order for lorazepam 2 milligrams IM times 1 now by Dr. Jones for John Smith for alcohol withdrawal. I'm going to verify the 6 rights of med administration, which is right client name, right medication, right route, right dosage, right time, and the 6th one I'll complete after I've administered the medication, which is right documentation. I'm going to gather my supplies, so I will need my MAR, my medication, my alcohol, 2x2, a blunt fill, syringe, gloves, and a label. Now I will demonstrate the 3 sites for intramuscular injection. So the deltoid, we're going to start with the ventral gluteal, so we'll have to put our client on their side. So ventral gluteal, I'm going to go put the heel of my hand on their greater trochanter. My middle finger is going to go on their iliac crest, my index finger on their iliac spine, my thumb is pointed towards their umbilicus. Then I'm going to go in the V. This is my injection spot for this medication. Can do the Z track by pushing up on the tissue, administering my injection, and then as I pull out, letting the tissue fall back where it would, and that helps keep the medication in. The ventral gluteal, I divide my thigh into thirds, both horizontally and vertically. I'm going to go in the outer middle third of the thigh, so about right there for my vastus lateralis. My last site is my deltoid. So I'm going to find the acromion process, go down 2 to 3 fingers breadths, and then my injection site's right there. Okay, now I'm going to prepare my medication. So I'm going to perform hand hygiene. Then I'm going to go to my medication dispensing, and I'm going to obtain my medication. So I have lorazepam ordered. I'm going to check the expiration date, which is October 2025. That's my first check. Then I'm going to compare my medication, lorazepam 2 milligrams per milliliter for John Smith. That's my second check. So now I'm going to have to do a little math. So my dose desired is 2 milligrams over my dose on hand, which is 2 milligrams per 1 milliliter. So I'm going to need to withdraw 1 milliliter of fluid. I'm going to put on a pair of gloves. Take an alcohol prep pad and clean the top of my vial for about 15 seconds. As I'm allowing that to dry, I'm going to open my syringe, peel it back, and then open my blunt fill, keeping this sterile. I'm going to twist that off and put this on. Leaving this in my package. I'm going to pull back my desired dose, which is 1 milliliter. And at this point, this should be dry. I'm going to use the double OK method to pull this out and leave my cap right there. And put this in the middle of my vial, inject the air, and pull back my desired dose. which is 1 milliliter. I'm going to pull straight out, scoop, and connect this. Then I'm going to take my blunt fill off and change to my needle, not allowing that to touch anything. I'm then going to label with the patient's initials, room number, medication, which is lorazepam, 2 milligrams. I'm going to do my third check now, which is where I compare the vial, the MAR, and my pre-filled syringe to make sure all of that is correct. My blunt fill would need to go in a sharps container that would be in my medication room. Then I would take my supplies to remove these gloves and take my supplies to my client's bedside. So I would need the order, the pre-fill syringe, the medication, and the alcohol swab. I would then knock on the door, perform hand hygiene, introduce myself to the client. Hi, Mr. Smith, my name is Faith. I'm a nursing student from Northwest Arkansas Community College. Can you tell me your name and date of birth? Do you have any allergies, especially to the medication I'm giving? So I'm giving lorazepam. He has no known drug allergies. I would explain the procedure. We're going to give you an injection into your deltoid muscle since it's 1 mil or less. Lorazepam is used for anxiety. Do you have any questions for me about what we're about to do? Then I can scan his bracelet if I have electronic and scan the medication as an alternate third check. Would then raise the bed. Lower the rail. Put on a pair of gloves. Find the site on my client. I'm going to use the right deltoid. I'm going to go down 3 fingers breadth and then right in the muscle we're going to use the injector pad. I'm going to start in the middle and work my way around. Allow the site to dry completely. While I'm allowing the site to dry, I'm going to grab a 2x2 and be ready to go. I've got my safety back for this particular needle. I'm going to use the double OK method. I'm going to stabilize my site. I'm going to hold it like a dart and let the client know they're going to feel a pinch. We're going to go at a 90-degree angle, 1, 2, 3, pinch. I'm going to use my non-dominant hand to hold the syringe and then I'm going to inject at a steady pace. I'm going to hold it there for 10 seconds, allowing the medication to disperse. Then I'm going to go back to holding it like a dart and get ready with my non-dominant hand to put on my 2x2 and pull straight out. Put my 2x2 on the site and deploy my safety. I never recap a needle, and then I would throw it in the appropriate sharps container, which is on the other side of the room. So let me do that. Would raise the rail. Help the client get in a comfortable position. Prior to this procedure, I would have ensured privacy since we're giving an injection and we don't want to expose the client more than necessary. I'd ask if they need anything else, hand them their call light, remove my gloves, and then perform hand hygiene.